Have you noticed that on cold days your face feels heavy? When you're really stressed, your smile isn't the same? Then this video is for you. The face is the most dynamic part of our body. The left side should move in sync with the right side. These are muscles that should relax completely and contract strongly to show our facial expressions. However, when you have facial paralysis, things end up changing a bit. The way you re-innervate and the way the muscle is stimulated becomes completely different. The muscles are no longer the same. And then you'll notice that on days when you talk a lot or smile a lot, you get tired. This can happen for two reasons. One of them is because your face still hasn't gained much strength yet, meaning it's as if you just started going to the gym. And with just a little exercise, you end up getting tired and your face can't move anymore. This happens to patients who start to recover from facial paralysis that lasted a long time. In fact, they notice the following. In the morning, their smile is better than at the end of the afternoon when they're already tired. If that's your case, don't worry, because you'll probably keep improving, and then that smile, or those movements that you're missing at the end of the afternoon will end up lasting longer throughout the day. The other situation is the patient who has already recovered as much as possible, but ends up with rigidity or synkinesis, which are movements that are a consequence of improper rehabilitation and cause the face to contract excessively. In other words, they have a lot of strength but relax very little. This patient doesn't get much worse at the end of the day. They have a problem where when they're stressed, their face becomes stiffer. At the end of the day, their face gets stiffer. Why? Because the face contracts too much, unlike the other patient who is improving and contracts very little. So if you notice that when you smile at the end of the day, or on a very stressful day, or when it's very cold and your smile pulls downward, maybe this is your problem. The first patient needs to rehabilitate calmly in order to gain strength in the right way. And the second needs to reduce the strength, which in this case is interfering with their movement. You see that these are two similar scenarios, but they are completely different. If you like this video and notice that there isn't much information about this on the internet today, like and follow our channel.